Hi, my name is Rena Barai and I'm a community pharmacist here at SG Barai Pharmacy in Sutton. I've been involved in the South West London Get You Better app community pharmacy pilot. We've been helping patients to download the app in our pharmacy and use it to learn how to look at exercises that are tailored in helping them support some of their issues that they may be having with aches and pains, pelvic floor problems, or people who are waiting for operations in particular for knee or hip replacements, helping them to have some exercises they can do in the meantime to help strengthen their muscles. One of the great things about the Get You Better app is that it's free, and often patients may look online and see lots of paid for services or are not sure which option to go for when it's downloading an app for exercise or getting support. And actually the fact that it's an NHS endorsed app and also supported by South West London and their local pharmacy team is promoting it in particular really helps patients to have trust in the information they're getting from the app, the exercises they're downloading, and the fact that they're getting support that's actually genuine. In our pharmacy, what we've been able to do is opportunistically help our patients. So for example, if we've been handing out a prescription for a patient who takes regular pain relief, we've been able to show them the QR code to download the Get You Better app at the point of handing out a prescription, so that we can have those conversations with patients who may benefit from downloading the app, looking up some regular exercises that may help them with some of their muscle, joint or ligament problems. Community pharmacy teams like mine are ideally placed. We're in the local parade of shops, or we're in the high street, or we're near where people live or work. Then we have really good relationships with patients who use us regularly, or patients who just pop in on an opportunistic visit. And actually that gives us the ability to talk to lots of different people about this potential app and how it may help them. Being involved in this pilot has really helped me to understand the need for digital health tools and the way they can help my patients in a different mode. And I really do believe that other pharmacies across South West London should have access to this Get You Better app and be able to support patients to download it and learn how to use it so they can help themselves with their conditions. In our pharmacy in particular, we see a lot of patients who are just struggling to know who's the best person to see when they've got issues with their joints or muscles or ligaments. So actually having the Get You Better app has been really helpful for us to support our patients. What we found is that some patients were a little bit hesitant to use an app, and so actually having our staff that were trained to help them download the app and show them how it works was really, really helpful. People often feel that they need to see a healthcare professional when they've got an ache or pain, and actually there's a lot of things that people can do themselves to help themselves, and that's where the Get You Better app has been particularly helpful, allowing people to understand that actually there are some exercises they can do to help strengthen muscles, strengthen joints, and that will actually really help them with their conditions. In our pharmacy, we often get people coming in to ask for advice about aches and pains or problems they may be having with muscles and joints. The only thing we can really offer them is pain relief over the counter, which is why I was really keen to get involved in this pilot. Having the Get You Better app just added an extra tool for us to be able to support our patients better. The Get You Better app allowed us to help patients in a different way than we've been able to help them before. I'm really passionate about self-care and patients learning to help themselves. And so the Get You Better app in particular was really supportive for patients to learn how to do exercises themselves that could help them with their aches and pains. So sometimes they wouldn't have to be so over-reliant on pain relief medication. Community pharmacy teams are ideally placed to help patients with apps like this, mainly because we've got good relationships with our patients and we know them well. They trust our advice and they come in seeking our advice quite often. But also we have a trained team of staff who are able to teach people how to download an app, for example, because there are people who are just a little bit afraid of doing things like that. We're able to support them to learn how to use the app, and then we're able to support them to then help themselves with their conditions. The benefit of the app is that after patients have done exercises for a period of time, if they're still struggling, they can use the app to book in directly with a physio, which is really great for patients because sometimes they never quite know how to access physio services in particular, and sometimes the general practice or the GP can be a bit of a gatekeeper for that, and actually this allows the patients to just self-refer, which is really important that we empower patients to try help themselves, and then when they can't, they can then get into the NHS system quicker. So movement is a medicine for muscles, and actually what we're really trying to encourage our patients to do is recognise that. It's too easy to pop a pain relief medication when you're in pain, and actually the Get You Better app has allowed us to have a holistic approach to the way patients manage their joint and ligament and muscle pain.